Chapter 11, the muscular system. This chapter is short, just like chapter 7 and 8, because it's mainly over the anatomy that you're going to be tested over in your lab practical for your final lab practical over the muscular system. So muscles the muscular system is going to include all skeletal muscle tissue. That's what we're talking about in this chapter. We'll talk about smooth and cardiac muscle in anatomy too. So it includes all skeletal muscle tissue that you can control voluntarily. Skeletal muscle can be organized in specific patterns. The patterns include parallel, convergent, the pennant group, and circular muscle. So rather than just telling you about it, I'm going to go ahead and skip to a picture, which you do have in your textbook, and I will go over the description with each picture. So we'll start first with parallel muscle. And as it sounds, parallel muscle, all of the muscle fascicles run in a parallel direction. Okay, just like the biceps brachii that you're looking at for your final lab practical, where all the fibers run, the fascicles run in one direction. We have the convergent muscle, which is where the fascicles start out wide and then converge into one tendon or a small point, like we can see in the pectoralis major muscle, where they start out wide and converge into one small tendon or point. Unipennant muscles is where the fascicles grow in one direction into a tendon. Okay, so we can see a white tendon here, and we see all the fibers or fascicles running into that one tendon. An example of this would be in your shin, the extensor digitorum longus muscle. Bipennant muscle is similar to the unipennant, but we're adding another direction of fascicle. So we have a tendon in the middle, and we have two directions of fibers growing into that tendon. So we have a direction going this way and another group of fascicles going that way, growing into the central tendon. Again, we call this bipennant. An example of this is the rectus femoris, or the large muscle on your thigh. We have multipennant, okay, which we're adding even another direction of fibers or fascicles. An example is the deltoid. Okay. And this is a little harder to see in this picture, but we've got three different groups of fascicle organization. If we look at a cross section right here, we can see 1, 2, 3 groups of different muscle fascicle organization. So we call that multipennant, and an example would be the deltoid muscle. A circular muscle is what it sounds like. It's shaped like a circle, and it includes things like the orbicularis oris, orbicularis oculi, that surround the eyes and the mouth. Some muscle terminology. Muscles can be identified by their origin, insertion, and their action. The origin is the stationary end of the muscle, and the insertion is the movable end of the muscle. Muscles can also be classified by their actions. An agonist is a prime mover, or a muscle that carries out the main movement. An example of this, if we're moving our arm, could be the biceps brachii that are going to actually help us pull our forearm up. And so if the agonist is the prime mover, then the antagonist would oppose the agonist. Antagonist would oppose the agonist, and an example would be the triceps. Okay, so if the biceps pull the arm up, the triceps can pull the arm back down. So they're going to oppose the agonist. And then we have synergist. A synergist helps the larger agonist work more efficiently. Synergist helps the larger agonist work more efficiently. A fixator is a synergist that assists the agonist by preventing movement at another joint. A synergist that assists the agonist by preventing movement at another joint. Names can also give clues to muscle characteristics. And if you'll notice as you're studying for your final lab practical, location. Some muscles can be named for their location. You'll notice that some muscles are called anterior, like the tibialis anterior, or the vastus lateralis, which is telling you it's towards the side of the body, or the levator labii superioris, which is located on your face, but it's going to pull your lip up in a superior position. Fascicle organization, some muscles are named for whether or not they're circular, pinnate, bipinnate, multipinnate, or parallel. Position, position kind of relates to location. If something is located up high, it might be called a superioris. If it's low, it might be called inferior. If it's lateral, it might be called lateralis, or medial, it might be called medialis, or just medial. Structure, size, and shape. Of course, larger muscles can be called majors, and smaller muscles can be called minors. Shape, like the circular muscles, can be named for their shape. Origin, insertion, and action. Again, an example of this would be the extensor digitorum longus on the shin. And that muscle is telling you what it's going to do. It's going to extend the digits or toes. The levator labii superioris. Levator meaning lift, labii lip, and superioris up. So it's going to lift the lip up. So many muscles tell you what they're going to do just by their names. Axial muscles, as you would expect, are going to be found on the axial skeleton, and they're going to help position the head, spinal column, and to move the rib cage. Appendicular muscles will move components of the appendicular skeleton, which we discussed in chapters 7 and 8. Here is the muscle man you've been spending most of your days with lately, getting ready for your final lab practical, and the many superficial muscles that you're working on. This is the anterior view and the posterior view of the muscles that you're working on for your practical. The axial muscles, again, are going to include muscles of the head and neck, vertebral column, the obliques in your abdomen, and the rectus muscles, or the abdominal muscles, and the pelvic floor, the muscles that line the inside of your pelvis. All would be included in the axial musculature because it's found on the axial skeleton. And of course, muscles on the head and neck are going to help make facial expressions. And really any muscle on the face would help with facial expression. Things like the orbicularis oris, which could certainly help you to smile, along with the buccinator. The occipitofrontalis muscles, which would help you raise your eyebrows. And the platysma, which helps you to clench your teeth when you're angry. So we can see all these major facial muscles on one of the pictures that you have also been studying for your lab practical, and any of these facial muscles would contribute to facial expression. Muscles of mastication or chewing. There are three main muscles of mastication. We have the masseter muscle, the temporalis, and the pterygoid. So here we can see the masseter muscle, the main large muscle on the side of your mandible. And we also have the temporalis. If you notice when you're chewing gum or eating, you can feel your temporalis or your temples bulging in and out as you chew. And this is why, because that muscle is right there on top of the temporal bone. So temporalis, masseter, and then if we peel the masseter off, we can see the pterygoid muscle, which is under the masseter, attached to the mandible, will help you to chew. Aging in the muscular system. As you age, the power and size of muscle tissue will decrease, and skeletal muscle will undergo fibrosis. Fibrosis is an increase in fibrous tissue in the muscle, which can lead to stiffening. It's an increase in fibrous tissue of the muscle, which can lead to stiffening of the muscle. Tolerance for exercise will decrease, and repair of injuries slow down greatly. This concludes chapter 11.